Hello, my name is Elizabeth Watkins. I'm a student at the University of South Alabama. Today, I am going to be encouraging healthcare professionals to implement an electronic health record. The electronic health record. Some would say an electronic health record is merely a computerized paper chart. However, it is that and so much more. An electronic health record is a real-time digital collection of a patient's health information, recording the patient's medical and health history, surgical history, familial health history, allergies, medication, diagnoses, laboratory results, test results, radiological scans and images, immunization records, hospitalization, clinical visits, and payer information. Having all of this information in one centralized location allows for a better service to the patient. Now that we have defined what an electronic health record is, let's discuss the benefits of implementing an electronic health record. Here on the screen, you can see that an electronic health record implementation can help with safer practices in healthcare, reduce error risk, medication error reduction, improving quality of patient care, improving clinical decision making, streamlining and automating provider workflow, enhances patient and provider communication, and enhances organization to organization communication, as well as increasing accuracy and organization of patient information. Having all of the information we discussed in the definition in one centralized location creates these benefits that are listed here on the screen. If you'll take a flashback in your mind to when there were paper records, whenever there was a paper record, the patient's history would have to be relied upon by the patient, and or we would request the medical record from the medical records department. And depending how old the patient's medical record went back, it may have been off site and take days to retrieve. Now having an electronic health record, the information is right there at the click of a button. Now this information being at the click of a button is created by the provider and the staff, and it allows consults to be facilitated, and it allows the management of this patient information to be disseminated quickly and easily whenever a provider needs it. It also allows the patient to be able to access their patient information to know what their laboratory values are, or even to make sure they're assessing their record for any inaccuracies. Now, I will say that the electronic health record has all of these benefits, yet it is not without its problems. Some potential problems with an electronic health record is privacy and security, patient safety, reliability, usability, and cost. Some problems that involve privacy and security and patient safety of an electronic record is to make sure that it is secured and checked frequently for possibility of hacker intrusion and or opportunities of data breaches. And if we can do those things, we can fix those problems and or stay ahead of those problems. The reliability of the information is dependent on the information provided by the patient and or family members, as well as the input of the provider. So in order for this information to be reliable, the patient and or family member must provide reliable information, and the user must be able to properly and accurately input this information. If any one of these is off, that is a problem for the electronic health record. Also, the usability. If the ability of the user to, as I said, properly input this information, then there are going to be gaps in the electronic health record. And last but certainly not least, the cost associated with implementing an electronic health record is definitely a potential problem. One of the reasons that some people and some organizations are against it or have not gone forth with implementing electronic health record is the cost. And it may not necessarily be just the startup cost. It's also the cost associated with the continuous updates that are required to keep the electronic health record safe, reliable, and user friendly. But I would like to say that I believe the benefits that you saw on the previous screen definitely outweigh these potential problems for implementing an electronic health record. As I mentioned in the previous slide, with an electronic health record, the patient can have access to their patient information. As well as the patient having access, other providers at other facilities and other organizations can also have access to this patient information. And this is done through the ability of health information exchange. Health information exchange is the ability of patients and health care professionals, nurses, doctors, pharmacists, and other healthcare providers to securely access a patient's vital electronic medical information, thereby improving the safety, quality, cost, and speed of care for that patient. Some of the benefits of a health information exchange is, much like the regular health record, it's safer for patient care. It reduces medical errors, medication errors. It also improves the quality of care. This is on top of the already improved care from just having an electronic medical record. It also improves the coordination of patient care, and it provides better tracking of the patient health information. It reduces healthcare costs by decreasing duplicate testing and treatment, eliminates unnecessary testing, and it supports clinical decision making. It also increases the patient's involvement in their care. If the patient has access to it from home, they'll be more involved in their care. It also provides patient health information that can be shared faster. This information can reach the doctor's office immediately. This is real-time information. Say you need to transfer a patient from one facility to another. There's no need to send a paper chart. There's no need to send a big printout or packet of this information. They have the benefit of accessing their health information through this exchange. It also allows for public health monitoring and reporting to improve. It's a quicker way to access that information. The information is right there, like I said before, at the click of a button. And with this information, the public health organization can compile all of this information that they're monitoring and they're tracking to make sure that we're not having any type of epidemics or anything of that sort. With the health information exchange, it definitely improves the quality and the care and the safety of patients. And like I said before, it motivates the patient to become more involved in their care. Having this information can reduce the error of even provider to provider handoff, because the information is right there in front of them when they get ready to do the exchange. A great deal of the information you have heard before comes from the Office of National Coordinator for Health Information Technology, the ONC, who endorses the adoption of technologies and the use of standards to share health information between patients, clinicians, researchers, and other healthcare professionals. The aim of the ONC is to encourage better patient care. They want better patient care, and the electronic health record will help provide better patient care. They also about promoting patient involvement in the care, and using an electronic record will help with patient involvement. They institute new health initiatives that will help the electronic health record flourish and grow and be used to the best of its capabilities. Some of the ONC legislations and policies are the HITECH Act, HIPAA, Affordable Care Act, the Food and Drug Administration Safety and Innovation Act, the MARCRA, and the 21st Century Cures Act. So, a little bit about these legislations. The HITECH Act is all about improving healthcare quality and safety for patients through the promotion of health information technology. HIPAA is all about safeguarding and protecting the privacy of the patient's information. That's going back to that problem that we had. Getting rid of that, that's what HIPAA does. The Affordable Care Act is all about lowering healthcare costs, improving quality and the access of healthcare. And with the health record, this can be achieved. The Food and Drug Administration Safety Innovation Act is all about making sure that the information is portable and that we also protect that information. The MACRA is all about providing resources to achieve the best possible care, and this is what the electronic record does. The 21st Century Cures Act is all about flow and improving the exchange of electronic health record. The ONC is behind these legislations and policies, and it's pushing for electronic health records to ensure that these things are achieved. A couple of success stories about electronic health record implementation. One is sometimes you can teach an old dog new tricks. And in this success story, the people found that whether it was an older patient or an older healthcare provider, yes, it was slow process in the beginning, but as the implementation went forth, they found that they are very pleased with the electronic health record, and it has made billing more efficient and been able to invoice their patients more easily. It has improved their patient care, and they are excited about having the medical history right at their fingertips. One of the other success stories is a storm that occurred in Joplin, Missouri, where there was an evacuation that had to occur. And the nurse was saying, the storm can destroy the hospital, but it cannot destroy an electronic health record system. So even in the evacuation process of their patients, they still had access to the electronic health record. And that's why it is very important to understand that whether we're teaching old dogs new tricks or whether there's a storm or evacuation, that the electronic health record success of implementation is greater than the problems that we can have, and the benefits definitely outweigh the risk. Connecting the electronic health record and the health information exchange provides better care, better outcomes, and better communications for the patients and the healthcare professionals, providers, and healthcare organizations. So I advise you to implement an electronic health record. Thank you for hearing me.